Good morning, everyone. Welcome back to Eldercare's Eldercare Academy training series. I am Adrienne Ostras.
And I am Josie, or also known as Jolene.
Yes, her emails come in over as Jolene, but she goes by Josie. This is her first webinar with us. I'm sure a lot of you have talked to her on the phone, so now you get to see her. So we're excited to have her on. And then we're also excited to have, for the first time ever on our training series, Aetna. I say Aetna ACA, but I'll say Aetna individual and family plans on with us. We have Michael with them. As always, just a few housekeeping things. We want this to be a conversation. We do these live for a reason. We do them so you can ask your questions, because a lot of times, there's new agents on and they don't know what questions to be asking. So please, if you have any questions, whether you're on the Facebook Live or you're on the Zoom, please find them and tell us good morning, tell us you can hear us. Let us know, are you currently selling ACA? Are you interested in it? Have you been doing it a long time? You just don't know about Aetna. I see a few of you still jumping on. I believe on Zoom, it's hard to find the question box. So it's, I think, a little box with a question mark and it says Q&A. It is not the chat. The chat is disabled. So you have to find the Q&A box to type your comments. I see Al-Anon, Bob, Chantel, Charles, Shirley. Good morning, everyone. Wendy, thank you so much for being on. Without further ado, I'm going to pass the torch to you, Michael, and let you kind of introduce yourself.
Fantastic. Good morning. So glad to be here with you guys today. My name is Mike Gwynn. I am a broker manager for Aetna CVS Health for our individual and family plans. I am located in Texas, so my main market is Texas, but I do serve as the primary point of contact for all of our integrity companies. So really happy to know Eldercare and to make another introduction, through that integrity relationship. So my contact information is on the screen. If you ever have any questions at all, feel free to reach out. Again, while I do service primarily Texas, I can help you in other markets as well. But if I can't, I can connect you with the ones that can. So we're a great team here, and we're so happy to help you grow your IFP business. We recognize that members have many choices when enrolling in a benefit plan. We'd like to be part of that discussion. So today we'll talk about the value that Aetna CVS Health brings to both our members and you as our broker. We're going to start out by looking at the services available to our members, and then the tools and resources we've made available for you as the broker. And then we'll move into talking about our national footprint, kind of where we're at, high level, some of our benefit options, because the benefits are not the same, across every state, but I will show you how to easily find that information specific to your market as well. So just a little bit about the history of our company. Aetna CVS Health and CVS Health and Aetna merged in 2018. And through that new partnership, Aetna CVS Health has been continuously focused on making healthcare easier to use and less expensive for our members. We take a lot of pride in offering a unique blend of access to the Aetna network of doctors, specialists, and hospitals that your clients know and trust, plus the extra value from our neighborhood CVS. And we try to do this at an affordable price. And we strive every day to make working with us as simple as possible. We're proud to offer a unique blend of both physical and digital tools to allow our members to feel confident that they are being supported during every step of their health journey. So let's take a deeper dive into some of these services that we do offer our members. So virtual care, virtual care and telehealth, these are two words that are often used interchangeably, and they've become more prominent over the last several years. However, virtual care has been around for over a decade, with Aetna CVS Health at the forefront. Bear with me, it's dust season here in Texas, so a little bit of allergies going on this morning. So
yes, everything is turning green.
So our CVS Health virtual care offering provides 24/7 access to telehealth trained medical providers that can be reached by phone, by mobile, and video for our members and their families. This solution provides your clients with affordable, quality care where and when they need it, access to mental health services, and cost-appropriate care options with transparent pricing. So that's really important to know what that service is going to cost. CVS Health Virtual Care through the Minute Clinic is offered at zero cost for our plan members, and these services can be accessed both online or via the mobile app. That this benefit complements a member's health plan coverage and is in place to increase access and convenience to managing their overall needs of care. And these virtual care providers can also coordinate with your in-person care options to ensure that each member is covered very holistically.
And so this is included on all the plans?
Absolutely, sure is. Yes. Another exciting offering in our portfolio is the Aetna over-the-counter health solutions benefit. We simply just refer to it as OTC. So this OTC benefit is a value-added feature that's focused on health and wellness. It provides members with up to $25 every 3 months. That's $100 a year that can be used on hundreds of CVS Health branded products, such as cold medicine, pain relief, and many more items right there in the store. And then there's also a catalog that they can use to order online as well. And this allowance is simple to use. It can be redeemed in the store, over the phone, and again online. And it's automatic. The clients don't have to do anything to earn the allowance beside being enrolled in one of our health plans. Another example of the commitment we have to combining both care and convenience for our members is the 20% savings via their member ID card. So when they get their ID card, they'll find a barcode on the back. This barcode provides a 20% savings on CVS Health brand items in the store. They can shop for eligible items online, or they can shop at CVS. They can do it online at cvs.com/shop. They can do it in the store as well at any CVS Health retail location. Redeeming in the store is really simple. It's showing the associates their ID card or providing their name and date of birth so the associate can look them up. And it's almost 1,000 items that's eligible for this 20% savings that can be redeemed in the store. So really, really exciting feature that we have there.
Yeah, I don't think I realized that. So it's the CVS brand merchandise within the store that no matter what, they get 20% off?
That's right. Yep. Absolutely. Yeah. So a lot of your what we call like your generic, cold medicines and things like that, the CVS branded items. Yep. Absolutely. And then we've got our member website and the Aetna Health app. These bring together the things that matter the most to our members' health. This includes personalized experiences, benefit and care options, and then guidance that's tailored to their health needs and goals. And a core component of the Aetna Health app is the accessibility it affords our members. By using the tools available, members can pay their premium and set up auto pay. They can search for virtual care providers and schedule an appointment. They can get cost estimates for procedures and price out medications. They can manage their prescriptions, request refills, and then find in-network pharmacies. They can update all their account preferences for more effective communications from Aetna. How do they want to be communicated with? They can do that in the app. And they can also use the chat feature to get all their questions answered as well. So again, all this available at their fingertips through the Aetna Health app, and then also through our member portal online as well. The Aetna Health website, as I mentioned, also encourages your clients to play a more active role in managing their health and benefits. So using the website and the app, they can have access to these as soon as they get their ID card. They can also access their ID card digitally. So if they don't want to carry a physical ID card, so many people these days, use their smartphones as kind of their all-encompassing tool to manage their life. Their ID cards are available in the app, and they can keep it there as well. And they can even download it to the mobile wallet within the app as well.
Hey, that's good.
And some other, oh yeah, absolutely. It's really
That's
simple.
what I do.
For sure. Other important Aetna Health functions allow members to view their health plan summaries. They can get details about their coverage. They can search for in-network providers, track spending and progress towards deductibles, as well as managing and submitting claims. And they can access all these tools anytime, anywhere, and it's available in both English and Spanish. So now that we've covered some of the programs and services available to members, let's talk about what's available to you as the broker to help manage your book of business and service your clients. So if you're contracted currently with Aetna, you're familiar with Producer World. It's your go-to resource for information on tools, reports, everything you need to support your clients. If you're already selling other lines of business, such as Medicare or group benefits, you're familiar with Producer World. But everything's all, it's kind of a one-stop shop for everything that we offer. Some of the useful items you'll find in Producer World includes our marketing, sales, and educational materials for you and your members. We've got broker assets like benefit grids and service area maps. And then your ready to sell status and guidelines to make sure that you're contracted properly, make sure that your commissions are aligned correctly, that your uplines or downlines are selected like they need to be. And you can access our quote and enroll tool, and there's so much more you can access through Producer World. So it's really easy. Returning users just simply use the link that you already have saved. Or with new users, you just need to answer a few short questions to get access to Producer World. And as I mentioned, we've got our quote and enroll tool. It's a valuable resource that can be accessed within Producer World. It provides you with a variety of tools to help manage your book of business. And so we've got just a screenshot there that you can see kind of what that looks like. With this tool, you can view high-level information on premium, membership, applications, any completed quotes. You can search for members by name, user ID, or their exchange assigned ID. You can view invoices. You can see coverage details, payment history. And it also helps you renew your members and submit new quotes. And then you can view all your quotes that you submitted or saved as well. And then something brand new for 2024 that we did bring into 2025 is our marketing studio. This is a self-service tool that offers a variety of Aetna CVS Health marketing materials for our broker partners to use. You can get customized items as well to use at events, maybe during open enrollment, if you've got any community marketing things going on. It's a really neat way that you can get personalized branded items for yourself. So this portal is also available 24/7. You can order CVS Health branded printed materials, promo items, digital assets, anytime, anywhere that you need them. So you'll receive access to the studio automatically when you become ready to sell with Aetna CVS Health. You'll get an email that includes your login and temporary password.
But it is a separate login, like from the Medicare Marketing Hub?
Yes, that's correct.
Okay.
Yep. So while hearing about what's available in the studio is helpful, we also want to provide you with a look at some of the assets that are available to order today. So as you can see on this slide, once you're logged into the studio, you'll have access to a variety of flyers and brochures, branded mail and email templates, social ads that can be posted to social media channels, and promo items, including pins, bags, Post-it notes, chip clips, all available for purchase. And so when searching for materials, you can filter by brand, state, or language. So you're only viewing what's relevant to your market and your members. And then customizing the materials is easy. When placing an order, you can add your name, phone number, and even more information. The material you've selected will update in real time on the screen to show you what your custom item will look like upon delivery. And we're constantly exploring new assets that can be added to the site in the future. So you'll want to, be sure and check that periodically to see if there's any new items out there.
Yeah. Do you, what's the age when people get off their parents' insurance?
26.
Okay.
26.
Do you have any like turning 6 materials?
We don't. That's a good idea, though. I'll mention that, but no, we don't.
I'm
But
on
that would be
the hunt
a good
for
one.
some.
Yes. Yeah. Absolutely. All right, so now we'll take a look at our product footprint. So we'll take a look high level. Again, we're not going to go really state by state, but we'll give you an overview of kind of where we're at and where you can find our plans. So in 2025, we are available in 17 states in a total of 146 new counties. So the colored delineations there, the purple counties were our counties that we had coming into 25, and then we added some new counties in the dark purple. So you can see the states that we actually had some expansion in as well. So we added 146 new counties, taking us to over 600 counties total across the country.
Well, I know that we have agents in those states.
Mhm.
Fantastic. And I added these slides actually just this morning, just to give you an idea of kind of once you get into Producer World, kind of where you go. and what you want to look for. Excuse me. So the black bar across the top, you'll see where it says home, individual, small groups. You always want to be on the individual section for your IFP plans. And if you want to look at state-specific information, you go to the middle of the screen there where I have products and plans highlighted, and then you'll select your state in the drop down. You can see I've got it defaulted to Texas. But so whatever state you're looking for information in, you would select that state, again, under the products and plans tab. And then it's going to open up the screen to the right, and you can see all the tools that are available within or for that state. Everywhere from how to use the marketing studio. We've got our renewal guide as well there. So when you have renewing members, you can pick up the guide and see what's applicable there. And then you can go down into the over-the-counter. You can see we've got the OTC information there. You can actually see the catalog, what's available for those OTC benefits. And then you've got the benefit grids. We get asked about that all the time. So this is where you would find your state-specific benefit grids, network information. You can see all the service area and maps as well there. And then scrolling further down, you'll get into your summaries of benefits and coverage documents as well. So again, great tool for you here. Again, individual section, products and plans tab, select the drop down for your state to open up that menu that you see there on the right.
Yeah, thank you for throwing that in there. It's nice to see exactly where to go.
Absolutely. So in this next section, we'll discuss some of the key plan features for 25. These will be features that are available for all of our states. We'll look at some brief overviews and then walk you through some of the highlights as well. So in many of our states, you'll see some of these highlighted benefits. Some states have state-specific benefits, but these will be, for the most part, what you'll see across all of our plans. We did talk about the zero cost access to CVS Health virtual care. We have zero cost as well when visiting any of our walk-in clinics nationwide. So we have a nationwide a network of walk-in clinics. So you would select walk-in clinic from the provider finder. And so these you can go in at any time with zero copay to visit any of our walk-in clinics. Then we've got our OTC program again, which allows up to $100 annually that they can use on CVS branded retail health and wellness items. We've got our 20% discount programs again for in-store or online CVS branded items, just using the barcode on the back of their card. And then new for 25, we offered a cap of $25 for preferred insulin on all plans. So huge benefit. So many people out there taking insulin these days. So we've capped that out-of-pocket cost to $25 for our preferred insulin. And you would find those on the formulary. Again, you can find those through Producer World. We have fertility treatment and artificial insemination that were added as a standard benefit under our basic infertility coverage. So that was a huge benefit as well this year. And then in just a moment, we'll look at our adult dental and vision coverage that we're now offering on select plans across our markets. Dental coverage will provide enrolled members with routine dental cleanings, as well as basic and major coverage, while vision members will receive routine eye exams and an allowance for frames and lenses. So we do offer those as an embedded benefit on some of our plans that we'll take a look at. And then we also offer $3 low-cost generic medications. We've got a whole formulary just showing those $3 low-cost generics as well. And then in some markets, we offer primary care services through our Minute Clinic locations. So Minute Clinics are not available in all markets. There is a separate network nationally for Minute Clinics, but where available, we do have some locations that we can utilize for primary care services as well. So.
Yeah, if anyone's interested in seeing, like, if you have any of those Minute Clinics in your area, just reach out to us and we'll help you see if they're in your area.
Now we've got about 10 minutes left. I think we're doing well here. One of our highlighted plans found in most markets is our Silver 5 Advanced 94% HMO. This is a great plan. I just wanted to highlight this one. This has been a very popular plan for us.
Okay.
You can see it's got a lot of zeros on the screen. So a lot of zero cost benefits available for our members. So as you're out there running your quotes, you'll probably see this one pop up. Very attractive plan here as well. So I like seeing plans that offer a lot of zeros. And now let's take a high level look at that adult dental and vision embedded benefit that we have. So as I mentioned, this benefit provides members with coverage for preventative, basic, and major dental services. They will also receive vision coverage that offers low exam copays and a $150 annual allowance towards frames and lenses. So members will be able to clearly see which plans include dental and vision just based on the plan name itself, which we'll take a look at that in just a moment. And then finding a provider or other questions, if you have any, if you need some help with these benefits, you can call member services on the back of the ID card to connect with any of our representatives that maybe can help address some of those network questions, things like that as well. And so this slide here shows you the states that the adult dental and vision is available in. The blue states are where we currently offer that benefit. So not all states, but the vast majority of those states that we have that. And I will send this deck out to you following the call, so you can use it to reference if anybody wants it. You can send it out to them.
Okay, I'm sure they greatly appreciate that.
Absolutely. I should have mentioned that at the beginning, so apologize for that. And so what I mentioned, the plan names, how to identify the plans, this is what you would see here. You can see any plan that has A, D, and V listed in the plan name as a plan that will offer that benefit. So all these plans will have mirror image plans that do not offer that. So you'll have the bronze 4, the silver 4, the silver 5, and then you'll have a mirror image version that includes the adult dental and vision benefit. And then we also offer something not mentioned on this deck. We also offer standalone adult dental and vision as well. And so that's also available in Producer World. So if you're looking for a standalone option, we've got a lot of brokers that do like selling standalone separate from medical. Yeah, feel free to let me know, and I can get you the information and resources for that as well. So we've got a great, probably got the largest vision network in the country when it comes to vision programs. So really, really good to have in your back pocket.
Yeah, that's good to know.
So this slide here just shows you high level some of the benefits available. I get asked about this all the time. And what's that look like? Well, it looks like most of your dental. There's nothing jinky about it, nothing unique about it. Very kind of standard benefits. Really the strength of what we offer is the simplicity to have adult dental and vision embedded into your medical. It's just an easier sell. Rather than having to enroll 2 plans, you've got the 1 plan. And then the network. The network is just vast, where the dental and vision, there's vast networks. So, why you would want to sell Aetna, really the simplicity of the product and the network reach as well. So. And just to recap, we do have a couple of minutes at the end for some Q&A, looks like. Again, very, very proud to offer a robust set of tools and resources that support both you and your clients for 2025. We offer a strong national footprint in 25 with a lot of service areas and plan offerings to help reach clients across all your markets. If you have any questions, feel free to reach out directly or go through Eldercare and they'll get them to me. I'm here to help you and help you grow your IFP business, and whatever I can do to help, I'm always happy to. So that's all I have at this moment. Okay. So I guess we'll spend the last few minutes and see if we have any questions to address.
Yes, we do have quite a few questions, and thank you everyone for submitting those. We're going to get them answered. I'm going to see if Josie wants to talk about what it looks like to get contracted.
Yeah, all you have to do is just give us a call and we'll send it your way.
And, if they've never done ACA before, are there any requirements or certifications or?
Just the FFM certification, as long as you got that done. And if you need information on that, we can provide that along with we have some training materials that we can offer to help aid in getting you ready to sell ACA.
Yes, don't be hesitant about it. It is one certification that you do have to do, is have that FFM completed. There isn't specific carrier certifications like on the Medicare Advantage side. Mm-hmm. So that's a positive, but you will have to do that FFM annually, kind of like you do your AHIP if you're doing that. And then also it will depend on the state if there's any additional lines of authority you might have to add to your license, things like that. So if this is your first time getting into ACA, please let us know. We want to help you. start that. I mean, this is definitely, something you don't want to leave on the table. You want to be able to help the entire household. Obviously, Aetna has great products to make that easy for you, keep it simple, as Mike says, positive for Aetna. We appreciate that. So I think that answered your question, Michael. Chantel, your question, if I'm already contracted with Medicare and supplements, will I have access to these benefits, or do I have to get contracted for the family and individual plans?
You will have to get contracted
Yeah,
to sell these plans.
it is a separate contract. And in saying that, I was curious, Mike, like when you're in producer world,
Mhm.
can agents see the individual stuff without the contract? Or will that
They can.
individual tab not show?
They can. So what you want to do though, you'd want to do so if you're already contracted for Medicare, it's really easy to add IFP. You just go to this ready to sell tab.
Okay.
I don't know if you can see my cursor or not, but right there in the middle of the screen, the ready to sell, you would open up that ready to sell tab and you just upload your FFM certification and make sure your commission assignment is correct. There's it'll say assign commissions, upload FFM. And then once you have the FFM and your commission assignment, you are technically ready to sell because our contract, Medicare does encompass both Medicare and IFP. You just have to be ready to sell to get paid for IFP.
Right, there's that additional step
Yes,
to
and
make that
then we
active.
have, I was going to go back to that map I had earlier. So some states are state-based exchanges, so you would have an additional certification you would have to do. I'm trying to remember. I think I'm going to get all these. New Jersey, Georgia, Virginia, Nevada, California. I think that's all of the state-based exchanges. I think there's 5. There may be one that I'm missing. But so you'll have to be certified in those states as well. So like California is called Covered California, Georgia is Georgia Access, New Jersey is called something else.
Yeah.
Virginia, yeah. So you can tell kind of by the name when they have those state-based exchanges. So.
And don't let that stress you out, like you have to go find where to go. Like we have all of these links and so you can go directly to it. No searching. Chantel wants a copy of the deck, so we'll definitely get that to you. Everyone that attends these live, we follow up right away to make sure, you have everything you need while it's fresh in your mind. Chantel also asked if they have to use an Aetna dentist. I'm assuming with the dental product.
That's correct. Yeah, you have to use our Aetna Dental Network. If it's out of network, then you would have reduced benefits. But yes, you have to use an Aetna dentist. Yes.
Okay. Wendy said that she attempted to quote her zip code and received the message, sorry, we don't have any plans in your area. So this map that you're showing, you have plans in the state. It's not the entire state though.
Correct. Yes, that's right. Yeah.
Okay.
That is correct.
It's only in certain counties, and maybe we can get a county map for a state.
Yes, I can send you that as well. Yep.
Okay.
I do have that. That's also in producer role, but I'll send it. I've got a list that shows state by state and what all counties are available.
Okay. Very good. Wendy, we can get that to you. Michael said more testing. Yes, technically it is another test for you to be able to do this. You should be very familiar with the process of being able to offer, health products.
And ACA is if you're doing AHIP, you'll appreciate ACA. The FFM certification this year was 15 minutes, 20 minutes tops, and most of it's just reading. So it's a lot painless. Now, some of the states, on the other hand, some of the state-based exchanges get a little bit more intense, but from a federal standpoint, the FFM, it's pretty easy. So.
Right. I'm glad you said that. Chantel asked, what is an exchange? Do you want to take that one, Mike?
Yeah, so the exchange is just where it's who offers the plan. So you've got the federal facilitated marketplace. That's the federal exchange. We refer to it as the marketplace. That's your national exchange. And then if you have states that offer plans, those would be the state-based exchanges. So the exchange is just where plans are transacted. So it's really all that is. So
Thank you for asking that, Chantel. We appreciate all questions. I know that we have a few agents on here not doing ACA yet, so I'm sure they're very curious with the lingo that we're using.
right.
I'd like to put the plug into, Eldercare is known for, being in the Medicare market, but we are also in the ACA market, and we do have all the tools to help you sell these products. We have marketing materials. We have Health Sherpa, which is a quoting and enrolling tool for all the ACA carriers. Aetna is on there, so you can use that. It's at no cost to you, of course. You just got to complete that FFM and get an ACA carrier contract, so we can help you with that. And I don't see any further questions coming through. Do you have any?
I do see one from Wendy.
Oh, okay.
Yeah, so if you expand into my zip code or county, will you be notified that it's available? Yes, and that's done through our national trainings. So no changes are made throughout the year. So right now we're working on 2026. That information will be released September, late September, early October, and then we'll start doing our rollout meetings. This year we did them recorded. For 2025, we did our recorded trainings, and those are in there as well. So when you go into your toolkit, you'll see all of the state recorded trainings as well. So, yeah, so that's how we release all the information. So,
Very good. Yeah, so it's really similar kind of to Medicare. It has an open enrollment period. And then you'll be watching for the expansions and new plans and new plan details for that following plan year.
that is correct. Yes.
I love Chantel's questions. Are there any bonuses for writing these policies?
No, you work for free. We don't pay anything on these. No, honestly, seriously though, yes. I was going to put my information back on the screen here. Yes, so there is the commission on I'll start with commissions. Commissions for IFP is a per member per month. So you get paid, forgive the lingo, but you get paid per belly button.
Okay.
Depending on the states are usually $20 or $25 per member. It is capped at a household of 5. And the reason why it's capped is because that's what FFM caps their ratings on. So if you have 8 people in the household, you're only paying for 5. So if you've got a husband and a wife and 4 kids, you're only paying for 3 kids from a premium standpoint. So therefore your commission follows that. So your commission's capped at 5. So 5 members per household, usually $25 a month. And then we do have open enrollment bonuses as well. So we'll put out some metrics every year, based on the volume that you write through open enrollment, you can receive some fairly lucrative bonuses as well.
Great question.
So from now through the end of the year, no bonus opportunities, but you would get paid. But then again, October, November, we'll introduce our bonus program for 2026.
Okay. Something to look forward to.
Absolutely, for sure.
All righty. If we do have further questions, we'll definitely follow up with you, Mike. We appreciate you sharing your email. Agents, I hope you are saving this. Having all of these people in your pocket, for helping is an amazing part of this industry. It's one of my favorite parts. Like you should always know who to contact if you have a question, because you have so many people here to help you. And we look forward to working with you, Mike.
Yeah.
Absolutely. I look forward to working with y'all too.
All right. Thank you, everyone,
All
for
right.
being here.
Thank
Y'all
you.
have a great rest of your
Thanks
day.
for having me on today.